So what to do about it? Surgery. You have to know that I'm a band-only guy. All right, I only do bands. Um, and you'll see in a moment why. I've finally figured out why too, and I'm glad that I went in this direction. I don't do bypasses, I don't do stomach staplings. I strongly encourage you to read about bypasses, to read about stomach stapling. Sleeve gastrectomy is the newer stomach stapling out, so that you're educated, because I want you to make an educated decision about what you're doing. If you need to come in and you want me to draw pictures and explain things to you and all those things, I'll be happy to. And the reason being is this: I want you to know what you want to do. I want you to have peace of mind with what you're doing. And if you don't want a band, tell me. I'm a busy guy. You're not going to hurt my feelings. And the most important thing is I'll get you to somebody who's good. Okay? I want you to make an educated decision about what you're doing. Okay? All right. Like I said, I'm a band-only guy. We pass this around. This is a band. Okay? This is your stomach. This is your food tube to your mouth. All right, and this is the bowel after your stomach. Entrails for those hunters out there. All right. What a band does is it turns your stomach from this to this. All right. You're down to about a half cup of food at a sitting. Between 600 and 1,200 calories a day. All right. You all are coming to see me because the band is less invasive and it's reversible. Okay. Less invasive. Now you have to understand all these other surgeries, all the surgeries are performed through small holes, okay? So that's not less invasive. Less invasive to me means this: the only thing a band does is it puts a kink in the system, a kink in the plumbing. That's it. Here, everything above, everything below is the same. Food goes through the same way, is absorbed the same way, everything. There's just a kink in the plumbing. We don't cut stomach here. We don't cut stomach across here. We don't go down to this bowel, cut it, swing it up, tack it in. We don't do anything. We don't redo the plumbing, okay? To me, that is less invasive, okay? Reversibility, what does that mean? That means if I operated again, took a pair of scissors, cut there, pulled this thing out, everything's back to normal. You'll be able to eat the same as you did before, okay? The only way that you'll know you had a band is by the scars in your tongue. Okay.
Why would a person have to do that for any reason? Or?
Sure. I mean, you can have complications, but more often than not, when we have complications, 98% of the time we put one back in. You know what I mean? I have had a patient recently who kind of sort of had a complication. It was minimal, but she looked at me and says, "I'm tired of it. I don't want it anymore." She says, "I think I can do it without it. I've learned enough." And I'm like, "Okay. That's fine." And so we did that. And she's actually doing okay, actually. Yeah, she's doing well. She's learned enough. Because she's been in the program a couple of years. Okay? So it doesn't happen very often. Most people want it as a crutch. Okay? Can this thing stay in for the rest of your life? Yes, it can. It's inert, meaning it's benign. It's not going to do anything. Okay? The real beauty of this thing is its ability to change. Okay? You all see that clear stuff in there, right? That's a balloon, okay? That balloon is attached to this tube, which is attached to this port. This is a portacath. Ports are a bit different these days, but this is a similar principle. Okay, there's a hard gel in there. All right, you can put a needle in that. I put my ports, if that's my belly button, right there. Okay? Ports are underneath the skin, on top of the muscle. They aren't hanging out. You can't see them, but you can feel them. Okay? That make sense?
Mm-hmm.
Okay. So it can change. Why is that important? Well, we're going to get this band in. It's going to be around your stomach. Not only you got stomach in here, you got fat in here. All right? And as we get this thing tightened down a bit after surgery, you're going to start losing weight. You can't eat. You're going to go down, 20, 30 pounds, and the next time you come in, you're going to look at me and say, "Dude, I'm hungry. This sucks. I'm not losing weight. Why did you put this in me?" On and on and on. Well, what's happened? You've lost weight. When you lose weight, fat shrinks. Okay? All of a sudden, fat shrink. You got more room to squeeze stuff through. Okay? So you can eat more. So the nice thing and the beauty of this band is that I can take you into this room over here and lay you on the table, put a needle in your skin through a scar that you don't feel, put it into this port, inject some saline in this band, crank it down, make it tight, keep you not eating, keep you losing weight, keep you being successful. Okay? That's the beauty of it. I can change it. Takes me about 15 seconds. Okay, doesn't take very long at all. Converse is true. What if it's too tight? What if you've been barfing? What if you had the flu? What if something irritated? What if something got stuck and everything's swollen shut? You can't even swallow your own spit. Happens. Okay, what do? Same thing. Take you into the room, put a needle in your skin that you don't feel, suck some fluid out, make it bigger. So stuff goes through. It can change. It's adjustable. That is the beauty of the band. Okay? And I don't have to operate to do it. All right? Weight loss. Weight loss with a band. I usually say for females, anybody over 250, you'll lose 100 pounds in a year. Anybody less than 250, depends on how far less than 250 you are. 60, 70, 80, 90. Whatever you choose to do. I've eaten my words. We saw a lady the other day. She's my lightest one yet, 104 pounds. Okay, didn't look too good. We told her to eat. We've had a couple now where we've had to say, you know what, eat, go eat some ice cream. You know what I mean? Because they kind of went the other way. That's not healthy either. But so weight loss, per those rules, it's about like that. That's been our experience. Go ahead, dude.
Is there a weight limit? Because I'm wondering if I'm too overweight for that then.
Oh, I don't think we've described that one. And if you think you are, I'll get you where you need to be so I can operate on it. That's usually what I do. I mean, I think the heaviest guy we started was about 450. And I don't do the super obese. The super obese, there's a lot of medical problems, surgical issues, that kind of a thing. If somebody works with me and be 550 and get down to 350 for me, great. But I don't do that. Yeah, I think the most we started with was 450. So no, and that gentleman right now weighs 240 pounds. Okay, so no, I'm not going to throw you away. Absolutely not. So it's all up to you on how much weight you want to lose. Men are a different story. Men will kind of do what they want, screw around, test the waters, think they can do it on their own, be a man. And then 6, 8, 10 months into it, they'll finally say, all right, I give in. And then all of a sudden, boom, they lose weight, okay? That's usually been our experience with men. How does our clinic do? Our clinic does very well. All right, we recently ran our numbers. Our weight loss is the same as, if not better than, a bypass, okay, which is unheard of, by the way. So we do very well. Why do we do well? Because we care. Because I don't focus on this, and I focus on you. That's the problem, okay? I feel the band is a Band-Aid. It's like pulling top off a weed. Weed's just going to come back. If we start focusing on the problem, and we pull that weed out by the root, y'all are going to lose some weight, okay? And to attest to that, when we talk about my numbers, when we look at those people that are 2, 3, 4 years out, their weight loss is still there. They didn't gain it back, okay? So that's pretty cool. I mean, that's a testament to everybody around me. I think that's just awesome. Basically, once again, it boils down to you. It really is. There's no easy way, I'm sorry. There's no magic pill, there's no magic surgery. Bypass patients think that they have a magic surgery and they just melt away, but you know what? Yesterday I operated on my first bypass revisions through a mouth because they gained their weight back, okay? Yeah, I just did the first incisionless surgery in the state of Minnesota yesterday. If you're looking at me real confused, which is pretty cool. So yeah, they're notorious for gaining their weight back. There's no easy fix. okay? I'll be the first to tell you. But you know what? Like I said, 50 to 70% of the time, you do the right thing or do a better thing, you got her made. And that brings me to my 3 rules, okay? I have 3 rules. Once again, I'll never tell you how much to weigh. And I don't care how much you lose, okay? I don't care how fast you lose. We're not about setting any land speed records. I'm about doing what you want to do, okay, at your own pace. Have I seen people lose 30 pounds in a month? Yes. Have I seen people consistently lose 3, 4, 5? Yes. I don't care. As long as if you got a generalized downslope, life is good, okay? I'm not going to be a Hitler. I'm not going to be doing those things. You know, this is all about you and your pace and what you want to do. So I have 3 rules because I'm never going to tell you how much to weigh. The first one is that you're going to lose every medical problem related to weight. Okay? Secondly, you're going to be able to physically do whatever you want to do. Chase your kids, grandkids, climb a tree, the Grand Canyon, run a marathon, all of which we have people doing. And thirdly, when you're all done, you have the ability to look in the mirror and smile. I think if you do those 3 things, I don't care how much you weigh. I think you're a success. Okay. Where do our patients end up with that attitude? BMI is body mass index, takes your height and weight into account, figures out a number. Normal's 25. Okay? Our patients end up usually, do we have people less? Yeah, absolutely. But the bulk of our patients are between 25 and 29. Okay, so they're in the overweight category, but I don't care. You know, they're a lot more healthy. They don't have medical problems and they feel good. More often than not, females, you know, they'll get to that place, they'll think, well, I'm going to get down to 140, and all of a sudden they're weighing 160, 170. They haven't weighed that since 7th grade. And they think they feel great. They like the clothes they're in. They feel comfortable, and they stop. And okay, I'm all right with that. This is your journey, not mine. It's all up to you. Okay? That's the bottom line.